Okay, we're going to start off with the part 2 series, and we're going to start with anti-infectives. So we're going to look at these antibiotics. Lefloxacin is a broad spectrum antibiotic. They treat bacterial infections, and you want to avoid sunlight. You do not want to take with calcium or dairy products or magnesium. It keeps it from being as effective, and don't take it with antacids because, of course, those contain calcium. You can get some ringing in your ears, or your eardrops can rupture. That's more common if you're over the age of 60. So you want to stop at if you have this tendon pain or inflammation. The story on lefloxacin: a patient has developed a bacterial infection. Lefloxacin has been prescribed. Instruct the patient not to take with dairy products or calcium-enriched juices. Do not take with antacids. Avoid sunlight while taking this medication, and beware of a pop or a sudden pain in your ear, as tendinitis and tendon rupture can occur but are more likely after the age of 60. Stop taking this medication at the first sign of tendon pain or inflammation. Okay, the next antibiotic we are going to look at is erythromycin. That's like your Z-Paks. This is an anti-infective medicine. It's commonly used to treat UTIs, cystic fibrosis. It's very broad, but there's a lot of side effects for this one that you want to watch out for. Treatment. It also treats Legionnaire's disease, whooping cough, acute diphtheria, and certain pneumonias. Now, it has been associated with hearing loss, vertigo, but it is reversible when the treatment ends. You want to give it on an empty stomach, either 1 hour before meals or 2 hours after meals for best absorption, but you do want to give it with water. Now, if it is upsetting your stomach, you can take some food with it. You need to report any palpitations, fainting spells, and give a history of QT prolonging if you've been seeing that on your EKG, if you've had hearing loss in the past. And it also has been associated with the Stevens-Johnson syndrome, and it will increase warfarin toxicity. You want to make sure you take all the meds and check for if they're allergic. This medication can be used to treat Erythromycin can be used to treat a broad spectrum of conditions. It is common GI upset issues. You want to watch for inflammation of the colon, Stevens-Johnson syndrome, and if taking warfarin, it can cause increased toxicity with warfarin. Okay, our next one. Okay, this one is metronidazole. It's also antibacterial. It's used for treating like anaerobic bacteria. So a lot of times if you're going to have colon surgery, they may give it to you ahead of time to just prevent that infection that could come from the anaerobes. Now this medication needs to be given slowly over an hour span. You need to take all of it, and you shouldn't be taking it with alcohol. It can leave that metal taste in your mouth. It can also give you dry mouth or give you a headache. This medication is given to patients about to have surgery on the colon. It kills anaerobic organisms only. The medication should be given slowly over a 1 hour span, and it can cause a dry mouth, headache, and a metallic taste in your mouth. The patient should be instructed to take all the medication, and alcohol should not be taken with this medication. Okay, we're going to move now to the anti-hypertensive. So on these, we're going to bring your blood pressure down. So clonidine is going to bring your blood pressure down, and it also can use to treat severe pain. It also has been used to treat ADHD. It reduces the sympathetic outflow of blood vessels to your heart, causing vasodilation, and it decreases your blood pressure. Now, when you stop taking it, there are rare occasions that it can cause rebound hypertension, so you need to be watching that. People who abuse drugs on clonidine will use this drug because it's cheaper and it gives some types of the same effects. You don't want to ever abruptly stop because you want to slowly decrease because you're watching that rebound hypertension. Before you give this medicine, make sure you're checking their blood pressure, and if it's too low, you want to bring it back up because it can cause drowsiness and dry mouth. It's less likely, but has been known to cause vivid dreams, nightmare, anxiety, or depression. And you want to watch for orthostatic hypotension. So when you're given it, you can be given orally or it can be given as a transdermal patch. You're going to watch for hypertension both laying down and standing up. So when you're standing up or you're laying down, you're getting up. You want to watch for being lightheaded and dizzy. You don't want to put yourself in a position where your patient could fall. And it is given in different routes. So that's an antihypertensive, and it does also an analgesic. Okay, now we're going to talk about antiplatelet drugs. So clopidogrel is an antiplatelet. It prevents the stenosis or the narrowing of those coronary stents, so that's going to help you prevent MI or a stroke. Now you want to check the CBC levels to check their white count, and you want to check for bleeding risk. You're watching for blood in the urine, black tarry stools, vomitus that looks like coffee grounds. So the story on clopidogrel, you have a patient and they've had a massive heart attack and they've had an MI. So you want to make sure that preventing the clot, you want to prevent a clot is preventing the blood from reaching a part of the heart. That's what caused them to have the heart attack. So now we need to get their blood flowing to that part of the heart. And now this drug is going to thin the blood so that the blood can go through and get moving to reach that area that hasn't been getting blood. Now as we thin the blood in one area, you may cause problems in another area. So you're going to watch for GI bleeding, neutropenia. It's going to drop those white counts, which is why you're doing the CBC. You want to monitor the CBC count. You want to discontinue 5 to 7 days before surgery. If a person is on clopidogrel and needs surgery, you can, and like it's immediate, like you've been taking clopidogrel, something tragic happens, you're in the hospital about to have surgery, they can give you things to start clotting. Now, if you're on garlic, ginkgo, or ginger, that's increasing your bleeding risk, so you want to stay away from those if you're taking clopidogrel. Okay, we're going to stop there for this video, and then we'll